on today, Mary?
Well, we're having a health and physical activity fair here at St. Pat's, and we've invited over 600 area 3rd and 4th graders from the Missoula area schools. Some of those schools are catch schools and some of them aren't. And so part of what we really want to do today is to really encourage those schools who are using catch to continue using it, and for those schools who may not be using it to get them to use it. And but regardless of whether they're a catch school or not, this health and activity fair really supports the health curricula that is currently being taught in all the area schools.
We piloted the project in 2 schools in 3rd and 4th grade classrooms for the first year, and then we expanded that to other schools in 3rd and 4th grade classrooms, and then we added additional components such as the physical activity, family home component, and some of the Eat Smart component. We have 8 schools that are going strong with catch, and many more schools that are signing up to start next school year. I think the most exciting thing about working with catch in the classrooms is just to get feedback from teachers and from the children, because catch really truly does work. When we get thank you notes from kids just saying, you know, this is a program that I learned how to eat healthier and exercise, and now I make goals on a daily basis.
Apple, plums, and strawberries.
The local health department, one of our hospitals, the university, all these agencies come together to make catch happen locally.
Often hospitals, they may be the largest employer in a local community. I mean, in Missoula, we're one of the largest. We have an obligation when it's something so significant to really step up to the table and to be a part of that conversation. So we made a determination that we would continue and pick up literally and add on to the work that had been done previously, because we knew it was the right type of thing that this community could really embrace. I think that it's reasonable enough that you could make a significant inroad into those rural communities by assisting in the actual purchase of the curricula, but also helping to build the capacity in those rural places for them to really take this and work with it on their own.
We had read about it. We were impressed with the literature and the science-based evidence that it really made a difference in the health of children, but we were interested in seeing whether or not it was a good fit for our community. And so we pilot tested it in 2 schools, and from then on it was like, this is what we want to do. This really makes a difference for the health of the children. The teachers like it. The families give really positive feedback about the information the children bring home. And so from then on we decided to be actively searching funding sources to bring it into more schools. The information we're getting back from the teachers is that the children are actually putting what they learn into practice. When they go home and talk to their mother about reading a nutrition label and there's something in here that isn't good for my heart, it helps the teachers know that they've made more of a difference in the life of that child.
The health department has a nice little graph and picture of all these different ones and how they interconnect with all the little spokes, and it looks like a spider web, which is probably a really good analogy, because you can catch the kids anywhere and find a good habit or use a good referral. So if you tell the pediatricians, hey, during summertime when they don't have PE, Parks and Rec is doing this program, or the YMCA is doing this program, or they can get into a free program with learning different exercises or things like that. And if all the providers know that, and all the parents know that, and the newspaper knows that, and Parks and Rec knows that, and everybody knows the same thing, the kids are all getting the same message.
My role as a St. Pat's employee is to work on 2 components of catch, the Eat Smart component and the family home component, to get those into all the school systems. We work very closely with the City County Health Department. My partner with the catch program, Lisa Timms, and I work together almost daily and do a lot of our activities together. So we're both out at the school working on different components of Catch. I may be in the cafeteria, she'll be in the classroom. And so that we work very closely together and have a plan in place for each school that'll benefit them. I do the training and also organize all the aspects of the family home component, but more so in the schools what I do is work with the food service staff to make changes to their menus that mirror the teachings of Catch, and also work with them on their wellness policies so that as they implement their wellness policies that we are making those changes as a part of their cafeteria offerings too. We have so many different partners, and that's really made it, I think, more workable. We try and make sure at each school we go to that we have a Catch champion, but also because there's so many of us in the community all saying the same message, it just makes it so much easier.
Most of the lessons are very straightforward, and we did a lot of discussing. We tried to do some exercising in the building, but mostly we put on our snow gear in January and took 10-minute health walks. Oh, wow. And I really became aware of gee, some students weren't in very good shape. When we talk about fruits and vegetables and things, they know that that's the healthier thing to eat. There is that underlying knowledge that I think they've built throughout their lives in their 10 years. But it reiterates that for them and makes it more of a concrete learning.
We probably don't want to have a ton.
We're always looking for good opportunities for students to actually do things and get to know a school-based or a specific population. So this was very exciting. As soon as we saw it, we thought this will work. Wow. And the students really had a good time doing it also. We need an intervention program. We need a holistic intervention program that has different components, not just the curriculum and not just the family component, but PE and also looking at the foods that children eat at school. So this program was perfect. It worked out, and it allowed us to have the students work with the school to decide how to implement the curriculum.
It's been interesting because we, as parents anyway, think of the school system as this big bureaucracy that we can't nudge, we can't necessarily influence. But when you work on a little smaller level and take one classroom at a time, it's been a very positive experience.
One thing I think is really important for other communities to know is that you really need to find a network within your community to partner with other supportive agencies that can help you kickstart this. Visit with the school board, visit with your local hospital, visit with your local health department. Find out where you can get support to make this a sustainable program.